Welcome to Our Toxic Nation, a call for Reformation Summit. I'm your host, Rachel Roshek, and I'm very excited to announce today's guest and topic today with Dr. Jen Phleghaar. Welcome.
Thank you. And you pronounced my name perfectly.
Oh, I thought you were going to say I didn't. Okay, great. The topic today is one I'm extremely excited to talk about, peptide therapy. But first, I would like to introduce you to our audience. Dr. Jen Phleghaar is a double board certified physician in emergency and integrative medicine. She went to medical school at Lake Erie College of Osteopathic Medicine, completed her training at St. Vincent's Mercy Hospital, and did her fellowship at the Andrew Weil Center for Integrative Medicine. Dr. Jen brings more than just expertise to the table. She co-authored Eat, Sleep, Move, Breathe, a guide to living a healthier life, and serves on the board of the Invisible Disabilities Association. She's also vice president of the Northwest Ohio Osteopathic Association and part of the American Osteopathic Association's Bureau of Osteopathic Research and Public Health. Her passion for healing isn't just professional, it's personal. After being diagnosed with Hashimoto's, Dr. Jen dove deep into the world of autoimmune conditions, hormone imbalances, and thyroid health. Now she's on a mission to guide others toward better health. When she's not sharing her insights on Instagram and YouTube as Integrative Dr. Mom, or running her health hub at healthy.bydrjen.com, you'll find her cheering on her kids, enjoying time on her mini farm in Tennessee, lifting weights, or soaking up wisdom from her favorite book, the Bible. Well, thank you so much for being here, and I'm very excited about this topic. I've had such good results personally from peptide therapy, so this is a topic I'm all about. So I guess let's start at the top. What exactly is peptide therapy, and how does that differ from other forms of medical treatments?
Great. Thank you, Rachel, so much for the introduction. And I love peptides too. I've seen amazing results using peptides in the last decade with patients. Peptides are chains of amino acids. So these are short chains of amino acids where proteins are long chains of amino acids, okay? Like proteins you would eat and you digest them. So peptides are shorter chains. So usually about 2 amino acids to under 48. Most commonly, it's like 2 to 36. And what happens when these peptides come into your body recognizes them and uses them to turn on or off gene expression, okay? And this is different from, say, medication, where it kind of forces its way in. I like to say peptides are like a lock and key mechanism, where medications and sometimes even supplements are more of like a crowbar and breaking in the door. So peptides they're recognized by our body to modify like gene expression and turn on or off genes. And with these peptides, a lot of, there's different ways to think about it. So if it's amino acids and, a peptide, how we take them, can they be broken down before they go in and tell the cells to do things? So this is why injectable peptides are kind of, the original peptides that we're using, because they go in through the subcutaneous tissue and then they turn on or off genes. There are some oral peptides that work really well too. Usually these are a little bit smaller, so they're not as broken down. They're usually fragments, or they're like tripeptides or 3 amino acids peptides. So when you look at how you actually get the peptides in and how to work, subcutaneous, more common. There are some oral ones that are available. Also intranasally is great, because you are getting those peptides to go right through that mucosal membrane and right into the system also. So peptides, they're so great because there's not a lot of side effects compared to conventional medications either, because like I said, they're kind of like a lock and key. You're not having to use a crowbar. You're not having to force the way into the pathway, the biological pathway. They work with your body a lot better. And with that, it's really exciting because we can do things such as in the longevity field, we can, extend lifespan with certain peptides and bioregulators. We can really help chronic illness like mold or Lyme disease with adding peptides into the treatment plan. So they're really wonderful if you haven't heard of them before.
They really are. And you can feel the difference too as a patient, that your analogy of, a crowbar versus lock and key, that's perfect because that's exactly what it feels like when you're undergoing treatment too. It feels like it's something you're meant to be doing.
Right, right. And yeah, because medications, there's definitely side effects, and
Yeah.
you're not restoring your body to homeostasis as much. Where peptides, and this is why you want to work with someone that is really comfortable using peptides, because there are specific ways you want to use them. You can do too much. You want to cycle on and off, or like growth hormone secretagogues, for example. You need to use them 5 days on, 2 days off, and give your body a break and check IGF-1 levels. So, there are some nuances to using peptides, but they are relatively safe.
Yes. What do you think well, let me back up. I'd rather ask you this one first. What are some of your favorite peptides?
Yes, absolutely. Um, the one that I just love is BPC 157, Body Protection Compound 157. This was actually isolated from gastric juices. And we make this, so BPC 157, we make it in our body. It's a peptide that our body recognizes. And this can be delivered in many different ways. Now, currently, we have some restriction with the FDA for BPC 157, and it's hard to get. Well, we can't get it compounded right now in the injectable form. So the injectable form works amazing. So body protection compound for tendons and ligaments. And they actually did a study on animals. They had rats that they cut the Achilles tendon, and the BPC 157 helped heal the Achilles tendon, because tendons and ligaments it works really well for. So BPC 157, a lot of its effects with the tendon, like recovery, all of that is because it works and helps with angiogenesis and increases blood flow and blood vessel support to the area. So it works really well. Like I said, the musculoskeletal side, but also topically, it's worked great for wounds. And they've done studies on it being used topically versus conventional therapy, pairing it with GHK copper peptides. It's quite amazing. I have a really good case study where a patient had a terrible ulcer due to some actual conventional mismanagement, and it healed it up so nice. Hardly any scarring either. Now, BPC 157 is readily available in the oral form. And the oral form we've been using for a long time to help with GI symptoms and problems, so gut health. Really helps with leaky gut or intestinal permeability, which in our toxic world, that's a big problem, because we're getting, environmental toxins from the air, from what we drink, from pesticides, insecticides, all the things. And what does that do? It tears down our gut lining and wrecks our gut lining, like glyphosate, pokes holes in that gut lining. So BPC 157 is really helpful and part of protocols for many chronic illnesses, because our immune system is in our gut. And when our immune system gets out of whack or imbalanced, then we start, not being able to handle common stressors, and even like chronic viral stressors, or, now we have COVID, before it was EBV and mono, things like Lyme, mold, so all of that. So that's why I love BPC 157, such a good adjunct to take orally. It's readily available, and it does well. It doesn't get broken down. It gets delivered well into our system through taking it orally. And BPC 157, you can pair with some other peptides, which I'll also share. But that is like probably top. I would say too, that most people know about this one now. It's becoming more trendy. More people are talking about it. I know at first when we talk about peptides, you're going to be like, what what are all these names? It's ridiculous,
Yeah.
right? It's so ridiculous that I've named two of my cats after peptides, just to like normalize them. Yeah, we have Foxo4 and Motc, both of which are banned right now. So, but now pairing BPC 157, one that I love is something called KPV. It's a tripeptide, so 3 amino acids. And this one is great for patients with any GI issues. So it helps because it's anti-inflammatory. It's actually part of alpha melanocyte stimulating hormone. And I love using KPV in mold patients too. It just like really just stamps down inflammation. And
Yeah.
what we see with patients, and I know you've been through all of this, that if you are dealing with a chronic issue or environmental mold or chronic Lyme, you're inflamed, your body is freaking out because it's trying to tell you that something is wrong and you need to pay attention to it. So say someone's having stomach issues, right? They're bloating, they're feeling bad. What are they going to do? They're going to go to their doctor and get drugs, usually a protein pump inhibitor, which is like pretty toxic. That it can be used acutely for a bleeding ulcer in the ER, but other than that, I don't think it has any place. And you're going to get Tums, you're going to get, you're just going to get all this stuff that is not healing the gut, but it's covering up the symptoms. So that's why peptides, like I spoke about before, working with the body better. So KPV also, you can apply that topically because it's anti-inflammatory. It helps with wound healing. Intranasally is good. I've found with my chronic mold patients that KPV intranasal really good for them and oral too. But if you think about it, when we have mold, we're getting suppression of the alpha MSH or alpha melanocyte stimulating hormone, and that can inhibit healing in the nose, and you can get colonized with mold in the nose. So all these environmental toxins, they can really wreck the body. So it's great when we have peptides to support you and get you kind of over that hump. Because sometimes with like the chronic illnesses, you've tried everything and you need just a little bit more support. So KPV is great, and it's, added on. One last favorite peptide. If we have time, we can always talk about more, but thymosin alpha 1 is one of my favorites. Did you get to use that one in your healing journey?
Not yet, not
Okay.
yet. It's on my list.
Yeah. And I just think it's great for everyone. I have it in my fridge right now. It's back. It's off the FDA category B list. So compounding pharmacies can make it safely. It's injectable. So I usually have patients use it for about 2 months, and then we'll take a break. So what it does is it modulates our T cells, and which are immune cells in our body. So thymosin alpha 1. So it's a thymus peptide, and our thymus is this beautiful organ that's immune system and regulates our immune system, that as we age, it disappears. You'll see it on little kids in x-rays. And then as we age, it disappears. And as we age, our immune system is just not operating as well, right? We're aging. It's part of aging. Our hormones go down, our thymus, system, all of that, it goes down. Our immune regulatory cells aren't as robust, right? And it's part of aging. But what we have seen with Dr. Cavasin's work of thymus bioregulators and thymus peptides is it actually helps with longevity and aging. Because aging, when our immune system ages, we get chronic disease, cancers, all of that. So thymosin alpha 1, if we're using that with someone that has an autoimmune disease, chronic Lyme, parasites, where our Th1 and Th2 immune system is unbalanced, and that's why we get these chronic diseases. We have an imbalance of our immune system. Thymosin alpha 1 helps support that. So I'm using thymosin alpha 1 in patients with autoimmune disease, with Lyme disease. We can use it with mold disease. Big help with chronic COVID and acute COVID infections. This is also a peptide that if you're rocking it and feeling good, you can just have it, in your fridge and use it to prep when you're flying or, traveling or something or stress. So thymosin alpha 1 is great. If you can't get the injectable, there's Thymogen, which is an oral alternative. So when we didn't have this available for a couple of years, it was banned because it worked really well for COVID infections. There's a lot of studies in China about how this would get people out of hospitals faster using this peptide therapy. And it did work really well. So if you don't have access to that, or some people are needle phobic, right? They don't want to inject themselves, and that's fine because we can put together a peptide protocol without injecting too. And so the Thymogen that you can take orally, or another option, you could take thymus bioregulators, which are really small snippets of peptides. So there are some other options out there to support your immune system, and you get a thymus peptide without injecting.
So speaking of bioregulators, I'm currently taking a bioregulator for my thyroid. Have you had, what has your work with bioregulators been like so far? I know it's like a brand new kind of area of medicine.
Yeah, I love bioregulators. So actually it's not new. It's actually very kind of old. Bioregulators are. So Dr. Cavison, the late Dr. Cavison, he passed away last year. So he was a Russian doctor, MD, PhD, who did lots of work on bioregulators. And they did studies on thymus and pineal bioregulators on like sailors, and it was really good research. So then they did studies on the elderly, and then they did this old person study, which they called. So one was age 60 to 75, and one was 75 plus. And it showed that taking just a thymus peptide would help extend life. So morbidity and mortality went down. And then adding in the pineal bioregulator would even like improve that number more. So this is not new, I would say, but it's picking up in the US. So before we would get the bioregulators, not the synthetic and the natural, but the natural ones from Russia. So what was happening with the Russia-Ukraine war, they were hard to get. So right now, I get them from England, Phil Miken's company, Profound Health. So these are, actual natural bioregulators, which are small snippets of amino acids, usually 2 to 4 amino acids. And this is derived from animals. Okay. So usually bovine, and they're basically so cleaned off and processed so cleanly that there's, it's just those amino acids. So they are specific to the organ system. Okay, that's what makes bioregulators really cool. So you can get lung, you can get thyroid as you're taking, Rochelle, you can get adrenal. My favorite ones are the pineal, which is going to help regulate sleep. And there's some longevity studies with that, and thymus. So those are top 2 if you're looking for, especially in longevity. And then blood vessel is pretty high up there, because what feeds our organs? Blood vessels. So those are really important. And there's this thought of lifespan. So increasing lifespan, of the organs also, right? So they've done studies on these to see if it's helping with, biological age of the organs, and also just lifespan. And, now we have all these cool markers like telomere length and OCMI score. So we can see how our body is aging, because what we don't want to do is we don't want to live till 100 diseased. We want to live till 100 and be healthy, and not have all these morbidity, all these diseases. So I think bioregulators are pretty awesome, because once again, like peptides, because they are a class of peptides, they work with your body. So say, for example, like Rachel, you're taking thyroid. So I give thyroid bioregulator to patients with Hashimoto's, which is usually hypoactive thyroid or underacting thyroid. And I also give it to my Graves patients or hyperactive thyroid, because it's not stimulating it, it's repairing like, and helping that organ get back to homeostasis. So bioregulators, they're oral. So they're just little capsules that you take. Depending on the protocol and the goal. Sometimes it's 10 days out of the month. Sometimes it's all month. So I have I have patients that are on year-long bioregulator programs, and we're doing true age diagnostic testing on them and looking at how it helps them age, helps their specific organ methylation scores. So really cool. And once again, like, it's a great option for those that don't want to do injections.
I think it's important, being that there just isn't much bioregulator use right now in the United States, that people understand and know that it's been around for a while. We just haven't had access to it. So,
Yeah, absolutely. Yeah,
yeah.
that's a great point. And also, yeah, like I said, I liked Profound Health. It's under Nature's Marvels. Their bioregulators are great. So I like the more natural bioregulators. You can get synthetic bioregulators. And they have a faster mode of action, so work faster, but their effect doesn't last as long. So are you on, do you know what kind you're on?
I'd have to look. It's a product called ThyroPep from Integrative Peptides. So it has a glandular and then the thyroid bioregulators. And I have hypothyroidism, and yeah, it helps a lot. A lot.
Yeah.
Like, it helped me give me the edge back that I needed to kind of take back control of my life after years of being chronically ill. So I'm really happy with it.
Yeah, and I mean, you're doing this amazing summit. I mean, that's a lot of work. So you're kicking butt.
I'm trying. Peptides are largely responsible for me being here right now. So, they woke me up from brain damage, and right now I'm taking a stack for leaky gut and some other gut issues with the BPC 157 and KPV. I love them. I seriously, it is my hope that these become more mainstream and, accepted. Do you think that will ever happen?
Oh, it's so hard. It's so hard. Conventional medicine. So coming from conventional medicine, I remember during the pandemic, I had doctors that were my mentors, like think
Mhm.
that I was just, a quack now. And I'm like, no, you're not reading the data. There is science behind these peptides. Now, are there, a bunch of placebo blinded randomized controlled studies? No, not as much, because who puts those on? The drug companies. There actually
Yeah.
are some bigger studies for like thymosin alpha 1 because a drug company does manufacture that now. It's like $20,000 a month. But, I mean, it's interesting because if you really go to the studies, like SS31, for example, it's a mitochondrial peptide. And there have been some really like niche companies like picking this up for certain diseases. So it's interesting. Mainstream, I think probably like 20 years. I mean, do you remember when like maybe 15, 20 years ago, it was weird to talk about probiotics?
Yeah. Yeah, actually, yes, I do.
Yeah. And you're like, oh, probiotics. And people look at you like,
Yeah,
what?
like
Like, what
you're
are you
like you're kind of
talking about?
crazy.
Yes, yes. So, I mean, and now if you go into a GI gastrointestinal office, I mean, some of them will talk about probiotics because when my patients come to me, they've either been to 20 doctors or they're
Mhm.
still working with doctors because I'm like, I love to collaborate and maybe, we can learn from each other, collaboration is good. But the probiotics, I feel like that's like a good example of, I think maybe 20 years or something. I don't know. There's also some amazing doctors that are advocating and compounding pharmacists that are advocating for peptides at the national level and to the FDA. Like, look, these are safe. When
Yeah.
we want people to get them from a safe place, we don't want them getting them from China and having, toxins and all these endotoxins
Yeah.
in them. We want them from a safe place. I think that's what's frustrating to me. It's like, look,
Yeah, very much
like,
so.
yeah, like we know these work, we know the data behind it says that they're safe, most of them, and there's a few that you just you have some concerns, and you have to work with your doctor. But generally these are very safe things, they're not medications that have to have black box warnings, that those go out without any problem. So I think it's going to take time. And that's why I really like to educate it, normalize, talk about peptides so people know that there's other options out there. And I'm sure, as I tell my patients, I have a plan A, B, and C, and then all the way down to Z, because everyone is different chemically, or all our biology is all different. So a peptide that's going to work, it's just going to knock someone's socks off.
Yeah.
Maybe they need a different combination for what's going on in their body. So I think it's beautiful that we have all these different options, from supplements, botanicals, and peptides. But I think it's picking up speed a lot.
Man, I hope so. I really do. Like, this is like a personal thing for me with peptides. If it
Right.
wasn't for peptides, I would not be sitting here. And I've lost count of how many cycles of different peptides at this point. But yeah, they're one of my favorite things to talk about.
Yeah.
Absolutely.
It's fun. My husband's so funny because he's like, we have too many peptides in our fridge. And I'm like, no, we don't. We got to make more room.
You just
I
need
love
a
to cycle stuff. So,
you just need a peptide fridge. That's just tell them
oh
that.
my gosh. So I got to meet, like, where we get all our compounded peptides from, this pharmacy in Indiana. And I got to meet the compounding part, because we don't live in the same state. So it was so fun. I got to hang out with her at this longevity conference, and her husband has a little mini fridge in his closet, so he'll remember to take it. And I'm like, that's so cool. What a good idea.
That
So
is a
some
good
people do
idea.
that.
Yeah. So what are your like what challenges are you currently facing being using peptides?
Yeah, absolutely. So one would be the FDA putting these peptides on this list where the compounding pharmacies were not allowed to make them. Okay. And there's still that list. The FDA gave back thymosin alpha 1, um, gave back CJC 1295, which is a growth hormone secretagogue. That's my favorite growth hormone secretagogue. So some of them are like coming back, but we still have this big block, like cerebrolysin. We can't even get that. Like, that's studied for helping with stroke. There are
Yeah.
studies on that. I actually presented at a stroke conference. I'm like, should I do it? Should I do it? So I threw up a couple slides on cerebrolysin to all of these like conventional like stroke doctors. And that's the thing, they might not have even have heard about it, but it's like, if
Right.
it's going to improve patient outcome, like, why aren't we using it in the US when they're using it in Europe? And we know why. There's a lot of exposure of drug companies. The United States and New Zealand are the only countries that allow drug companies to advertise on TV. We're fighting a really big money driven situation, and
Yeah.
getting people better for cheaper is threatening that, right? Peptides are
Yeah.
probably a threat, unfortunately. But like I said before, when they're so I only prescribe peptides from compounding pharmacies, because if you're getting them just online, they're labeled for research purpose only. So
Yeah.
it's hard. I mean, there's a few out there I would recommend, but I can't say with 100% confidence that there's not endotoxins or LPS in there, when you're injecting it into your body. So that, I would say, is like the biggest challenge. The oral peptides, all the big companies out there. Do you want me to say companies? Because I know the owners of all of them.
Go for it. Yeah. No,
Okay.
please.
So you
Please.
brought up integrative peptides. Kent
Yes.
Horkoff is awesome. Healthgevity with Michael Antone, they're great. And then Kyle with Level Up Health. So
Yeah.
I know, like, I know them. I know the owners of all of these companies. So that's great. We know they're safe. You can ask for a certificate of analysis on their
Mhm.
products and all of that. So you have to make sure that you're safe. I think the other thing that's kind of I don't know. I don't know if it's good or bad for peptides, but this whole Ozempic GLP-1 explosion. I mean, I
Mhm.
almost think it's set peptides back. I don't know. I would have to think about that more, because they're being used wrong in my,
Yes.
yeah.
Yes.
Okay. So you
Yes.
think it's kind of like,
It's like,
like,
what are they doing? Like, you can't take it every single day without taking a break. Like, you've got to give your body a break.
yes. And like, when you get it from the pharmaceuticals, it's a little bit different. Maybe it's not as pure, I've heard. And, so I have patients get their GLP-1s and GIPs compounded. So then we can be so niche with like titration and with what they want to do. And, the GLP-1s they really help with inflammation. So I have a patient, she just messaged me last week. She's like, so I feel the best I've ever felt on like 3 units. So like just a sniff of tirzepatide, just like the littlest drop, right? She's like, I feel so much better already. Is it placebo? And I'm like, I don't think it's placebo with peptides. I don't think it's placebo.
No.
So this is a beautiful like medication. And I'll admit, when I was using semaglutide, when I used it the first time about 8 years ago on a patient, I think I went a little bit too hard with her, and she like lost some muscle because we didn't have the research on like how it can really affect muscle tissue. So she's doing great now, and she kept all the weight loss, and she was only on it for 3 months, but we probably went like a little too aggressive. So now, like, the past like 5 years, I'm really start low and slow, almost like how you dose hormones. You start low and you go slow. But I mean, that peptide in general, it's on every commercial and stuff. But gosh, I was at a conference for the American Osteopathic Association, because I do some advocacy for the, more holistic, integrative, functional stuff. And specifically like breast implant illness and food. But anyway, like one of the docs that I'm friends with, he's older, and I heard his continuous glucose monitor go off and beep. And I'm like, what's going on? And he's like, well, my sugars have been so much better on Ozempic, but I'm on the max dose, and he'll probably be on it forever, right? So he's on the max dose forever. And he was eating for breakfast like a pastry. And I'm like, well, that doesn't work. Like, that's not what we want, right? Like,
No.
we want it to work, and this is different. So in contrast, I had a patient came to me, was asking his primary care doctor, like, he has type 2 diabetes. He's like, I want to get off insulin. I want to get better. What do I do? And they couldn't tell him anything. They couldn't even suggest a diet. So I had him, cut carbs. Oh, and they wouldn't give him a continuous glucose monitor. It was so bizarre. I'm like,
That's
why
weird.
are you withholding this from someone that wants to get off meds? It's so weird. So anyway, he's off all of his, all oral, he's off metformin, he's on his short acting insulin. And last time I spoke, he's even off his long lasting insulin. He's on a small dose of semaglutide, and he is eating basically low carb, almost animal-based carnivore. And he's thriving. He's thriving.
That's
And
awesome.
yeah, and lost weight and inflammation. Now, and this is the beautiful thing, that peptide, that semaglutide coming in, right? Just coming in really soft and nice to help his body, wake up. It's almost like it wakes, up those beta cells and really helps. So I think this is where, when we look at the Ozempic, Wegovy, Zepbound, it's everywhere. It's on every commercial. Yes, it's beautiful. Yes, doctors have been using this peptide for quite a while. And I think the positive side, because I spoke a lot about the negative, the positive would be now we have tons of studies on it. So
Yeah, that's true. That's
good.
really true. Yeah, no, that really is. I have to say this, like, what the FDA did with cerebrolysin is, in my opinion, criminal. I am walking, talking proof that cerebrolysin not only works to heal brain damage, but it's safe. The one that I took was an oral version, but it's very similar to cerebrolysin. It's an integrative peptides product. But yeah, because with that ban, I mean, you can't get it injectable anymore. At least I don't think so. So
There's one source in Russia, I believe. I have it. If you need it, let me know.
well, thank you.
Yeah. So there's one source, but it's, once again, it's research purposes only. But I had a lot of physicians tell me it was okay to use. And this is when we're talking about like stroke, we're talking
Oh
about
yeah,
serious stuff. Like,
yeah.
I agree. I think a lot of the things with functional and integrative medicine have been criminal. And I'm hoping that they start, it starts to get called out a little bit more, because it's really
I hope
inhibiting
so.
people from healing.
It truly is. Like, I know I can only speak from my own experience, but I in 2006 I hit a guardrail going 60 and was knocked unconscious with, once I hit that guardrail. Um, I had two moderate concussions that went misdiagnosed for a really long time, but then I also had peripheral nerve damage that went through the left hand part of my body. The cerebral lysin healed both of those things. Like, I can feel my body again. And I remember when it first, like, it was the third cycle of cerebral lysin that it happened, and I went to go ride my bike, around the block, and I couldn't figure out how to turn because I could feel the whole left hand's, part of my body again. I had to basically relearn how to ride a bike, but that's amazing. I
Yeah,
mean,
that's
it
beautiful. Yeah,
it really is.
you don't hear that. And,
No.
with using conventional medicine.
No, absolutely not. Absolutely not. I'm on a lot of support groups and stuff like that. People they just don't get better. And that's a problem.
Yeah. I have a really cool story about a patient that had mold illness that came to me. And first we had to get him out of the mold,
Mhm.
but I mean, peptides really helped him. So we layered in some gut health peptides, BPC 157, also low dose naltrexone. We used ivermectin, and then thymosin alpha 1. So balancing that immune system. And he went from being, so what happened, it was mold injury, but it was an injection triggered that triggered it and kind of made him go off the edge. And he was on disability, and he was back to driving his boat by the summer. I mean, this is why I feel like a lot of these long haul patients, they're basically like chronic fatigue EBV patients, right?
Yeah.
And it's just so frustrating that they're not getting the best treatment in my eyes, and they're struggling.
Yeah. It's very frustrating. I can tell you as a patient, from a patient's perspective, it's infuriating. Is when all you want is to just get well. And then, it's not even, it doesn't even make sense that these therapies aren't available. I don't, and I do understand, and I really want to say that I don't, but so yeah, that was actually my next question for you though, was what improvements have you seen in patients undergoing peptide therapy? Any notable successes or anything you'd like to share?
Yeah, I had another patient that had Hashimoto's, and she was early in Hashimoto's. She was swinging kind of back and forth between hyper and hypo, which sometimes you can get with early Hashimoto's. And she was like all in. She's like, I'll go grain free, I'll go gluten free. And she was fine with throwing the peptides in there right away. So we did thymosin alpha 1, and then also worked on her gut health with BPC 157 and KPV, and really helped her, and her Hashimoto's went into remission and still is in remission. So pretty amazing. And then I also layered in, after we got like the acute issue settled, I layered in some thyroid, adrenal, and thymus bioregulators. So that's another thing, you can like layer those in and
Mm.
work those in also. And because they're very subtle, and they're great. I had another patient, a peptide I didn't talk about was lorazepatide. So lorazepatide is something that the drug companies are picking up and sniffing out, but there's a lot of cool studies on lorazepatide. And it is a synthetic peptide, and it helps with leaky gut. So it helps inhibit xylem. So xylem in the gut opens up tight junctions, and those tight junctions are, what they're open, then we have leaky gut. So xylem helps regulate that and stop xylem from opening. So, oh gosh, I had this patient who had horrible diarrhea and just could not get better, like couldn't go out, had to wear, a diaper, like it was just awful. And she had tried like everything. She came to me and she had tried everything. She hadn't tried peptides yet though. So she started on lorazepatide, and we were up to 500 micrograms 3 times a day with her, and that stopped the diarrhea, it helped her gut actually. We did BPC 157 too, though. But it helped her gut actually catch up, right? And actually like be able to heal. Because I think that when we look at peptides, I have a course that talks about peptides, and I do peptide prep where we prep the body for peptides, right? But I also think that sometimes, and this is where specific situations can be different, if you're so bad off that your body just can't self-regulate at all and can't even like prep or heal, like that one patient I had, that sometimes we throw them out there, and we get the body under control. And the reason why I think with peptides is we don't want to just like throw them all out before even working on just pillars of health like sleep and eating right and movement, is that they are expensive. Like really, that's the only downside of peptides. I don't know if you'd agree with that. Like it's just the price, and it's hard because I feel like my generation grew up in this like insurance should cover everything. And
Yeah.
yeah, and it's so hard to get across to people. Like, okay, so you have car insurance, right? This is how I try to explain
Mhm.
it. You have car insurance. Your car insurance is for if there's something catastrophic, like an accident or something. It doesn't cover gas. It doesn't cover, oil changes, new tires. It doesn't cover any of that. So why do we think that health insurance should cover everything? Like we need to get away from that and realize that health insurance is catastrophic, right? Like, and that
Right.
we're gonna have to like put money aside for things like peptides, for things like, sauna, red light, whatever, for other modalities, if we want to be a well-oiled machine or car and we want to go the
Yeah.
long run. So I think that when I try to explain peptides to patients, I try to be like just really open and be like, I think it's time for you to use these. I know they're expensive. If someone is like hesitant, if someone
Mhm.
is like comes to me and they're like, I've heard about peptides, like I'm ready to go, they already kind of know that it's a little expensive, and I'm gonna make sure that they're using them properly. But most bang for your buck with peptides, I would say, make sure you're doing some of the basic stuff and then add them in, and you're going to be like, oh, wow. So I think that, with those patient examples, I kind of showed how they can be used differently.
Yeah. Yeah. That's amazing. Is there anything else you'd like our viewers to know about peptides before we go today?
Yeah, I mean, I love talking about peptides. I do on my website. I have a peptides 101 course that kind of goes through, like I said, peptide prep, and all the different peptides. So it's geared towards patients and practitioners if you want to learn a little bit more. It's a science, to use peptides, but also if you're just listening and you're an advocate for your own health, you can learn about them. You're able to read studies and take courses. So don't be afraid of it, for sure. But also, find someone that uses peptides so they can just point you in the right protocols too.
I agree with that. Definitely find someone who's done it before. Wouldn't recommend just going doing it yourself because it's like you said, you're working with your body to try to get it to do what it does best. So make sure you have your foundational building blocks in place. And yeah, all right. Well, thank you so much for joining me today.
Thank you, Rachel. That was so much fun. And I love talking to you and just just the amazing stuff that you did for your health. And you're just kicking butt now, like I said
I'm
before.
trying. I'm actually about to do a cycle of lorazepam on my YouTube channel. So I'm doing that for leaky gut. So I'm excited. I'm really looking forward to doing these cycles kind of publicly so that people can see like kind of what the process looks like and what it feels like. So I'm
Yeah.
really excited. I have high hopes that peptides will become mainstream or at least accepted, mainstream wise. So I'm going to push for that.
Absolutely. I'll try with you. We'll both push.
Awesome. All right. Well, thank you so much.
Thank you.
Bye.